You're listening to a brief excerpt from How Hospitals Can Shape an Effective Systemic Pandemic Response by Utilizing ISO 9001, co-sponsored by DNVGL Healthcare. During this webinar, DNVGL Healthcare is joined by Norwegian American Hospital of Chicago, Illinois, for a discussion on how ISO 9001 helped guide them when their community was devastated by COVID-19.
Hello everyone, and welcome to today's webinar, How Hospitals Can Shape an Effective Systematic Pandemic Response by Utilizing ISO 9001. My name is Barry Smith, and I want to thank you all for taking the time out of your busy schedules to join us today. During the webinar, we're going to talk about ISO 9001 Quality Management System and how Norwegian American Hospital in Chicago, a DNVGL accredited hospital, has utilized the ISO 9001 system to shape a strong pandemic response. As we get started, I would like now to introduce our guest speakers for our webinar today. Simile Miller is a standards application and interpretation specialist for DNVGL Healthcare. Before moving into this role, Simile was a primary instructor and lead surveyor for DNVGL Healthcare. Simile has over 25 years of experience in quality and safety management in hospital organizations. She began her career in facilities and safety management at a large healthcare system. Simile has worked with hundreds of hospitals implementing and teaching ISO 9001, making her one of the leading experts for ISO 9001 implementation and interpretation in the healthcare environment. I'd also like to welcome Heather Kahn. Heather Kahn is Vice President of Patient Care and Chief Nurse Executive at the 185-bed Norwegian American Hospital in Chicago. She previously served as Administrator, Clinical Operations at Beaumont Wayne Hospital in Wayne, Michigan, and Stroke Program Coordinator at Henry Ford West Bloomfield Hospital in Bloomfield Township, Michigan. Prior to that, Heather spent 20 years as a nurse and nurse manager at Aurora Sinai Medical Center and Brown County Hospital in Wisconsin. She earned a master's degree in business administration from Cardinal Stritch University and a bachelor's degree in nursing from Berlin College of Nursing. Welcome, Heather. And finally, I'd also like to welcome Gabrielle Sauter. Gabrielle is a pediatric nurse practitioner and Associate Vice President of Clinical and Community Operations at Norwegian American Hospital. Gabrielle has been at Norwegian American Hospital for 6 years and has significantly grown community programs. Right before the COVID-19 pandemic, she transitioned from the Director of Mobile Services to the Associate Vice President role. Her knowledge as a nurse practitioner, combined with her experience working in the community, enabled her to quickly initiate drive-through testing for the community. Additionally, she adjusted the ambulatory care clinics during the pandemic and maintained clinic volume compared to the previous year.
Thank you, Simile. This is Gabrielle, and good afternoon, everyone. I'm going to start with some background information and context. So Norwegian American Hospital is a 200-bed standalone safety net hospital in Chicago. We have been in the community for over 125 years, and our mission is to provide high quality and compassionate health care services by partnering with patients, families, employees, physicians, and the community. In addition to our hospital, our ambulatory services have about 25 clinics, including primary care and specialty care, as well as 4 robust community programs. Overall, 80% of our patients are African American and Latinx, and only 20% of patients are privately insured. I will also add that prior to the COVID-19 pandemic, our community faced significant challenges. 46% were considered food insecure, compared to the 13% nationwide. We had a 12% unemployment rate, and our community had one of Chicago's lowest educational attainment, with only 13.9% of individuals graduating college. As a hospital, we had completed our first accreditation with the DNVGL in December of 2019 and had not yet been ISO 9001 certified.
Thank you, Gabrielle. This is Heather Kahn. Just wanted to provide some context of how we decided to revise our quality management system in the midst of COVID. COVID changed everything in our country, our community, and of course our hospital. We had changing guidelines, we had psychological, economic, and social repercussions of COVID, and our staff had a lot of uncertainty and anxiety. So it's our job as leaders to take control, to provide direction and unity, to make sure that what was known, what could be controlled, that we did control. So really aligning that organization to protect our employees and keep our patients safe. And so risk-based thinking really was paramount for us to give us that certainty of outcomes that we were looking for. It helped us make better decisions, especially in operating in times like this with COVID.
You've been listening to a brief excerpt from the How Hospitals Can Shape an Effective Systemic Pandemic Response by Utilizing ISO 9001 webinar presentation. This webinar was co-sponsored by DNV Healthcare and recorded on July 23, 2020. The full webinar included an interactive speaker presentation with audience Q&A. You can watch the full webinar video by using the link that appears now on your screen.